Well, hello everyone. This is Dr. Ella Tharp with Tustin Longevity Center. This is November 15th, 2022, and we are meeting here to talk to the doctor. We are a integrative functional medicine general practice. We have gynecologists and naturopaths, and we see people to try and work on looking at different ways to approach their health for maintenance and prevention, as well as trying to restore health to those that have already been diagnosed with chronic medical problems in general. And we have 7 doctors here that are working to try and help you with this restorative type of functional medicine. And we use both our knowledge as standard physicians, naturopaths, physician assistants with our training and our consultants. And we look at the wonderful world of preventive medicine, herbal medicine, naturopathic, allopathic, all the modalities that we can bring to bear to help your body do its best. So we have these question and answer evenings once a week from 6 p.m. to 7 p.m. And what we try and do is provide a venue to ask questions and see how we would approach certain things. This is not meant to be personal medical advice. If you are a patient of ours, please contact us at the office at 714-544-1521 if you have an urgent question or a concerning issue. Of course, you need to seek immediate care, then do so. But this is what we have here. We have several emailed questions that come to us in the week. You'll see at the bottom here, there is a link that you can write a question to us through the email, and this will be sorted out from our other email to be directed to us. I never get these until the evening of this. They're waiting to collect them all, and so I never see the questions ahead of time. So I'm answering these fresh. If I don't have the information or knowledge to help, I will let you know that, or I'll try and look into some information hopefully by the next week. So this is an educational process for myself as well. And over the time, hopefully our other clinicians here will find the time to maybe participate as well. So let's begin tonight with the very first email. That's from Carol. And she goes, here is a very interesting and important site to watch. I know that you can't talk about it online, but I thought it would interest you. Thank you for all your knowledge and health information. So she gave me some email, and I haven't seen this. It's, https:// then go and the number 2.propaganda-expose.com/ docuseries / episode dash the number 1 and a /. So I don't know what it is, but maybe that will help you to go find it yourself. Okay. So thank you, Carol. I'll try and find time to look at it, and thank you for the effort and time to try and keep me informed too. I do appreciate that. The next question is from Asia. Asia says, hello, Dr. Ella Tharp. My father has had a dry cough for many years. He's also always congested. He is mostly health conscious, not on any medications. He takes vitamins daily and drinks tea. He is not a smoker. What would you suggest to help the cough and congestion? Thank you for everything you do. You are in my prayers. Thank you, Asia. I do cover the prayers of my patients. Asia, I do know, I think, who you are and your approximate age. So I do know that your father is in the older group. And what happens with us as we age is our skin starts to thin and wrinkle. We bump it and it bruises more easily than when we did when we were younger. That means the thickness of the skin is getting thinner, As we lose muscle mass, collagen, and bulk, then the capillaries are much more closer to the surface. And the same thing applies to the nasal mucosa. Your nasal mucosa is to stay moist and heat up the air as it is taken into our lungs. But as we age, that thins out also, which means any common air irritant, pollen, or whatever can be brought in, and it can have easier penetrability to the nasal mucosal area and irritate it, like pollens or other molds or viruses or what have you. This then is what is called senile rhinorrhea. Almost all adults, as they get older, they start to have trouble swallowing. They can accidentally have their water or even their own saliva drip back and hit their larynx box in the wrong way, and a drip will get into their their larynx and make them cough or water. And this is because as we're aging and sagging is occurring and muscles are weakening and the hyoid bone and the vocal cord laryngeal box there, it's changing ever so slightly, sliding its position, and it can get that drip. Then you'll have this chronic cough. So exercise is important. Staying well hydrated is important. Often, if we use natural hormone replacement therapy, our thickness of our skin doesn't get as thin and easily bleed or bruise or penetratable to pollens on the very thin already mucosal surfaces there. Very often, it's helpful to take and be very mindful of avoiding pollen generating food allergy generating foods. If he knows his blood type, if he's an O type blood, it's probably smart for him to try and stay away from grains. Alcohol and the molds in alcohol are often a concern. Using natural antihistamines, we use Dehist here. It is a quercetin-based natural antihistamine, natural antiviral. Moistening the surfaces with Argentin nasal spray up the nose morning and evening is another smart thing to do. And then I guess if you have to, maybe a long-term acting over-the-counter antihistamine, something like loratadine or Zyrtec, citrulline, citrazine. These are both over-the-counter, once-a-day, non-drowsy antihistamines. But that's basically what it is, Asia. And of course, he should see his doctor, listen to his lungs. If he's had a chronic cough, he should probably get a simple chest x-ray just to be sure that there's nothing else going on, and follow up with his doctor. DM says, hi, what do you suggest as basic supplement possibilities for someone who has an artificial valve and takes warfarin daily? So many supplements and foods contain ingredients that affect bleeding times when on warfarin. Something for joint pain, digestion, brain function. Thank you. DM, I would say this. Warfarin is prescribed by your physician, cardiologist, internist to prevent blood clotting, and it slows down a certain vitamin K2 dependent pathway. And if you eat leafy green vegetables rich in vitamin K1, then you're going to need more warfarin. So if you are eating a diet that's healthy with healthy greens and a variety, your vitamin K1 level is going to vary. That means your warfarin dosing is going to vary. That means it's going to be more difficult for your cardiologist and your internist to maintain a level, a range of anticoagulation. So what that then means is they're going to, I think, poorly advise, in my opinion, you to eat an inferior diet that doesn't have these wonderful nutrients in the foods. That's why, you suggest in this the paper here, uh, you're saying he is mostly healthy, takes vitamin, drinks tea. No, wait a minute. He eats many foods that contain ingredients that affect bleeding when on warfarin. So it almost becomes frightening to eat good food just to make sure that your internists and cardiologists don't have a hard time managing his situation. I don't think that's the right way to look at it. I think you should be advised to eat a healthy diet rich in organically raised, trying to avoid pesticide herbicides that have good leafy green vegetables in it for nutrients, and take a digestive enzyme as you digest it. But then I would say um, it's their job to do the monitoring. So uh, there are enzymes like Vitalzyme and Vascuzyme, Proteozyme that are taken on an empty stomach morning and evening. And these work as natural anti-inflammatory, which are anticoagulation uh, benefits. I take Vitalzyme myself 5 in the morning, 5 in the evening. So I don't get arthritis, I don't get blood clots, I stay uninflamed. Your internist and medical doctor who give the warfarin will have to get educated, and they will have to spend time. And you don't get paid for all these times that we do this, nor do I get paid for the extra time in doing this here. But we became doctors to do the right thing, not the lazy, convenient thing. So what about water? Water is a wonderful anticoagulant, uh, blood thinner. This, if you drink half your weight in ounces, so let's say you're 200 pounds, and then that means you need 100 ounces every day. That would come to 16-ounce glasses this full every day. So I have a different take on someone who has an artificial valve or valve replacement, or who is on anticoagulant therapy. I'm not saying not to take the warfarin. I am saying eat healthy, even if that means eating leafy greens. I am for eating a healthy diet, drinking the water, exercising, staying active so you don't get venous stasis from being immobile. I am for eating a low carb that prevents clotting. I am for avoiding inflaming foods such as the grains with all the glyphosates and um, genetic modified changes in them. I am for taking the enzymes that help prevent clotting and a good night's sleep. So that is what I would do. Another thing, vitamin K2 is different than vitamin K1. K1 is involved in the clotting pathway, whereas vitamin K2 is involved in calcium metabolism to avoid abnormal calcification on the lining of your blood vessels and other soft tissue deposits. So that's what I would say, DM, is use the systemic enzymes for joint pain with a good um, uh, benefit for inflammation and pain reduction. Drink half your weight in pounds as ounces of water every day. Eat a healthy diet, low in carbs, avoiding food allergies. And then exercise and consider natural hormone replacement therapy for optimal memory, brain function, and such. That's how we would approach it. And I have many, 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 many decades and decades of patients over the years that have been on Coumadin or other blood thinners. And I advise them that indeed these are the things they are responsible to do. Their doctor should be advising them, and they should follow the patient, not the patient trying to eat a more inferior diet to make their blood checking job easier. Sandra has a question called, I am 56 and I've been in menopause for 2 years. I have the CHEK2 genetic mutation that puts me at a high risk for breast cancer as well as thyroid cancer. My mom got breast cancer at age 45 and died at age 50 from very aggressive breast cancer. I had a preventive skin and nipple sparing mastectomy at age 51 and a thyroidectomy for thyroid cancer at age 52. My question is, with having this genetic mutation, is it safe for me to use hormone replacement therapy? I've been told the benefits outweigh the risks, and I've been told absolutely no. What is your opinion based on recent research of CHEK2? I still have my uterus and ovaries. After my mom's diagnosis, she had a mastectomy and preventive chemotherapy, and her cancer still metastasized. My sister and my niece are also CHEK2 positives. Those are only family members that have tested. Thank you. I think natural hormones are given to us by our Lord for repair, rebuilding, remodeling, maintenance of our immune, maintenance of our mental functions, maintenance of our bone health, maintenance of cardiovascular health, and so many other things as well. There is a book out there called Estrogen Matters. It debunks this volume of ignorant mythology, in my opinion, that hormones are to be feared. Now, you've done preventative things. I am not an expert on the CHEK2 mutation, so I will look that up. GECH2 mutation. And the if your oncologist who is advising you about this, or your doctor, geneticist, and they're not telling you about the strong association between insulin, the growth promoting, tumor promoting, fat promoting, blood vessel thickening, heart disease promoting impact of insulin from a American casual standard diet, then I think you're getting a biased, one-sided, lopsided guidance. Insulin is to be feared far, far more than any mutation, because it takes the environment, the terrain, to create enough strain, hypoxic stress to allow a gene to be expressed. If that gene is supposed to be expressed, it would express itself right away, and cancer would be popping out very early. But the CHEK2 gene is a mutation that can be, under certain conditions, promoted. And those conditions are what we are here telling everyone regarding whether or not you know if you have various mutations or not, to keep them in suppression. And that is with a low carb diet, enough water, exercise, good sleep, higher levels of vitamin D. Our ranges are 80 nanograms per deciliter to 120. Theirs are 30 to 60. We test the iodine levels. Low iodine levels are clearly associated with thyroid cancers. Our diet is miserable in iodine. No one is testing except for us. The iodine, read the book called Iodine by David Brownstein. David Brownstein. It is a tremendous book. But you see, nobody makes money on reading books and telling you to supplement with iodine, or to self-discipline yourself, to exercise, get enough sleep, drink your water, eat a low-carb diet, eat in a time-restricted zone, have your doctor check an insulin level, every 6 months, your triglyceride, your fasting blood sugar, your hemoglobin A1C. People don't make money doing that. But they make lots of money on these goose chases for genes. There's been no great breakthroughs. There's been no great medical breakthroughs in management and treatment. So that's my opinion, uh, Sandra. And my suggestion to you is read the book Estrogen Matters, read the book Iodine, and trust the fact that we are designed to live, to have a good immune system, to check and prevent genetic mutations from their being expressed. And there are no medical schools teaching this, maybe some naturopathic schools, about the wonderful enzyme systems that are out there in our bodies working every day to look at our DNA everywhere in our body to repair damages, how important the circulation is, EDTA chelation therapy to improve microcirculation, the importance of water, the importance of certain vitamins, nutrients, vitamin D, zinc, and the like, the importance of a good night's sleep, the importance of exercise, the importance of a time restricted eating so you don't eat late, and on it goes. So the good Lord allows me to make enough income here by doing a lot of inspiration to my patients and follow up and accountability. But I don't make any money on big drugs I sell them or interventional things or surgeries we do. Ours is educating each patient's dear special needs as they come through. And I am pleased to announce that Medicare has found me and our clinic to be one of the few clinics in the United States, one of a few physicians out of the hundreds of thousands, yea, million of doctors that we probably have in this country, that has the healthiest Medicare patient, oldest population, most functional, needing the least amount of medicines, the least moving on to cancer, the least moving on to heart attacks, the least moving on to diabetes, and on and on and on. So I think they should send some of their medical students here, and we'll give the glory to our Lord who made us. Jenna has a question and said, my husband is a healthy 67-year-old and not taking any prescriptions. Very good. He started taking one Prostasol Forte in December of 21 when his PSA was 4.0. We are told the range was 0 to 4 for his age. In March, his PSA was 3.4. However, last week, his PSA was 5.4. We are having it retested next week. Do you recommend that he starts taking 2 Prostasol Forte capsules daily? What else do you recommend, and what PSA number do you think is good for a 67-year-old healthy man? Blessings and happy Thanksgiving a week early, Jenna. Thank you, Jenna. Yes, as men, if we all make it to 85 years old, I think the Bible says a natural life is 70, and if by strength, 80. So if we make it to 85 and we biopsied every man that on his 85th birthday, his prostate, and we did a breast biopsy of every woman her 85th birthday, we'll find breast cancer and prostate cancer. Cells age and cells start changing their characteristics from very healthy looking cell and nuclei to a more stressed, wrinkled, and aged. And that's basically what pathologists are looking for when they see the nuclear DNA and changes in the cell. And then we're all going to die, at least in this body. I thank God all my sins are paid for by my Lord and Savior Jesus Christ. So I'm eternal already, and I don't need to worry about these things. I can be busy about loving my patients, my family, my grandchildren, and the world, and not worry about myself because I know where I'm going. But we're all going to die. So the older we get, the higher the PSA typically is for men, which means the bigger his prostate is. Now, the thing that your doctor and urologist should be aware of is that the prostate gland is a gland, much like the breast is a gland of glandular tissue, and the thyroid is a gland. And all glandular tissue tends to behave in their environment with growth parameters. For instance, estrogen helps stimulate breast glandular development, and progesterone puts the brake on it. Testosterone tends to have a stimulatory impact on male testicle and possibly prostate and other things, of course. And um, the iodine in the thyroid and in the breast and in the prostate is part of glandular metabolism. So if you have a low diet of iodine, your thyroid is going to want to grow more glandular tissue to try and scavenge and get iodine out of the system passing by in the blood and lymph. Your breasts will want to grow to get more iodine. Your prostate will want to grow and to get more iodine. And so we know, if you read the book by David Brownstein, that iodine supplementation helps to reduce the prostate size, the breast size, the ovaries, uterus, thyroid goiter, and usually there isn't a cancer risk to people who are always adequate in their iodine intake, and we can measure this. That's why I take iodine all the time. Now, alcohol is associated with the metabolism in the liver, alcohol dehydrogenase, because estradiol is an alcohol. If you eat a high carb diet, your carbs will ferment in your stomach and produce some alcohol. And that'll exceed the natural design of your liver for the tiny amount of alcohol eating would generate, or estradiol would generate in your body, because men make estradiol. So another thing I would tell your husband is don't drink alcohol. I have seen men who have a beer every day or two, and their estrogen levels are higher than mine. And I'm postmenopausal, and I take estradiol every day as a prescription to have enough in me so I don't get hot flashes, night sweats, bone loss, and I get good memory and a good night's sleep. And yet these men think it's healthy and fun to drink their beer, but they're killing themselves with it through estrogen, and that estrogen is coming from their alcohol, and that's making their prostate swell. There's a another natural approach I give the men in my practice. I will give them an estrogen metabolizer blocker called anastrozole, Arimidex. At higher doses, this is what women use for breast cancer management, but at a very tiny dose, a half of a milligram twice a week, this blocks the men from their prostate being swollen from the estrogen impact. The other thing is I put them on a low carb diet, tell them don't drink alcohol, and I ask them to stay away from fructose, high fructose corn syrup, a high carb diet. I tell them to get a EDTA chelation to improve the circulation to their prostate. Go on enzymes, Vascuzyme or Vitalzyme, either one, on an empty stomach twice a day. Most men need about 5 twice a day. I'm a big girl, so I take 5 twice a day. I have more of a male build in size and dimension. And then I retest their PSA in a month or two, and I always see it go down. I always see it go down. And one more time, I always see it go down. And I correlate with the men, their alcohol consumption, and the improvement in their PSA, their estradiol level, their testosterone level, and so it goes. So that's how I would address it. You could use 2-prostosol tablets. I have seen some men take 2 tablespoons worth of raw pumpkin seeds, just raw pumpkin seeds. It's cheaper. If you get raw organic pumpkin seeds and have 2 tablespoons and chew them up a day, that is probably enough in and of itself. So there you have it, Jenna. Tara has a question. Hello. What would you advise regarding anxiety and hair loss? Thank you. I don't recommend it. So, for me, for my anxiety, I use the Holy Bible. I read my Bible every day of my life, 4 chapters every morning before I wake up. I mean, no, before I go to my workout, before I go to the gym every day. That is reminding me that I'm a created being. It reminds me of my history and the people that are loved so much by God, how important we each are, and how much I matter, but then again, how small my problems are in light of the whole world and the great needs. And I get my eyes off my problems and I get them on to serving other human beings of all sorts. So that's what I do. And I exercise. That helps anxiety. And I drink enough water. And I take natural hormone replacement therapy. I just had a lady come in today who's living, she's 54, family stress, and she had to move out of her house for reconstruction and had to move in with family. And there is some, addiction problems in the family she's moving into, and relationship problems, and husband is stressed, and her children are high school age. They're stressed. Everyone's stressed. And she couldn't sleep, and it was just deteriorating. And she was also menopausal, and I gave her hormones, and voila, she was able to get some good restorative sleep. That sleep and those hormones helped her be more even toned, even keeled, more mellow, you might say. And she tolerated the stressful, anxiety producing situation. Of course, she could also use some ashwagandha or some TLC Calm. Copa Calm is what we have here with ashwagandha in it. We have magnesium drinks that are very calming. Good enough vitamin D to get those levels of vitamin D up into that 80 range are very mood enhancing levels for vitamin D. Exercise, I do 5 days a week. So there's many things that we can do for anxiety. Hair loss, stress is a major inhibitor of tissue repair and buildup. It is like being on chronic steroids that are breaking you down, breaking down your tissues. So just by doing all the things I said, and having that pattern of reassurance and those healthy lifestyle things, healthy nutrients, healthy herbs, natural hormones, vitamin D, exercise, then you should be able to see your hair grow thick and nicely over time. So that's how I would begin to approach that, Tara. Now, of course, B vitamins are important for stress, and biotin is in that family of the B vitamins. And I do take the B vitamins every day as well. Deb says, I recently had a bout of ringworm. That's a skin fungal infection, which I contracted from 3-month-old kittens. I was treating with a fungicide and it was very stubborn. She must mean a topical. I began to apply wild organic oregano oil, and that seemed to dry it up more quickly than the prescription's fungicide. Yes, because oregano oil is a natural fungicide. How long will it take this outbreak to subside? Will I need to worry about future outbreaks? The kittens have been treated by the vet with oral meds as well as fungicide dips. They seem all better, and I keep getting ringworm patches. Very frustrating. Can you suggest something that might help kill the fungus, or should I stay the course I'm currently on? Thank you for your direction and any advice. Well, an immune system that succumbs to surface fungi breaking through the cracks in our skin implies your immune system is not doing as good a job as it should. So I would be interested in the most common immune destroyer for Americans is the high carb, sugar, high fructose corn syrup, fruity sugar diet. And so the number one thing I would do is fasting, intermittent fasting, time restricted eating, and exercise. Getting a good night's sleep to restore your immune system. And then getting, you'd probably put you on Juice Plus because it'll have vitamin C in it. Vitamin C helps the architecture of our skin, our collagen, elastin repair. I would have you take a multi-mineral, such as TLC multi-mineral for the zinc and the selenium, and others that are very important in anti-cancer, immune boosting. So a multi-mineral that has the zinc and selenium and other known valuable trace minerals for our immune system, a low-carb diet, a good night's sleep, exercise, don't eat late at night, that's immunosuppressive. And then get that vitamin C in with Juice Plus, very likely. Vitamin C will help, but that's in the Juice Plus, and the Juice Plus has been researched for immune enhancement. And then topically, I would use Argentin Silver. Argentin is a fungicide. It's anti-yeast, anti-candida, fungicidal. It's a spray, so you could spray it on your hands. And you could spray it on the kittens, and that would help. It's an antibacterial, antiviral. It comes as a gel. You could rub it on as a gel over your hands or elsewhere. You could take it and swallow it and use teaspoons of this, swish and swallow, gargle with it. You can spray it up your nose for viruses and fungi and bacteria. So that's another thing I would do. And I think that's how I would begin to approach that. And let's see. The last email question I had was from Leah. Hi, doctor. I heard you said that you take DHEA instead of testosterone cream. That's true. What dosage would I take if I take 2 milligrams of testosterone cream? Thanks and God bless. I take the DHEA because it does so much more than just straight testosterone. The DHEA is a precursor to many other downstream things that your immune system needs. Your testosterone for muscle, your adrenal gland for good adrenal support, helping you stay calm and handle stress better. If you're on 2 milligrams topical daily, I would probably be on 50 milligrams DHEA capsule, one a day. And that's what I use. I use 50 milligrams. So that was the simple one. That's what I would do. All right, let's get to some of the ones that are here right on the current chat board. And so we want to say hi to Garden Fairy. My thyroid nodules have grown more than 20% in the past year, and wonder if there are labs I should ask for before my endocrinologist appointment. Biopsies are negative, but some Ca in outer, calcium in outer nodule, and has a history of Hashimoto's. All right, well, I would do a 24-hour urine iodine challenge collection by Doctors Data. Doctors Data in St. Charles, Illinois. They do an excellent, consistent, reproducible, and this is the one that is put out by the book called Iodine by Dr. David Brownstein. And the iodine is very important in helping shrink the thyroid, taking the systemic enzymes to chew up the debris tissue, benign tissue in the thyroid gland or anywhere else in your body. Drink half your weight in water as ounces every day. be a low carb diet and take selenium, a multi-mineral, every day, at least 200 micrograms of selenium every day, if not 400. And I would wait another year, and then I would do the food allergy test besides the 24-hour iodine, because you're probably eating something chronically because you have Hashimoto's diagnosed. So that's a food allergy, that autoimmune attacked your thyroid. And you're probably still eating that food that's creating irritation. Garden Fairy, that's how I would begin. Dolores McConnell. Hi, Dr. Rita. I am 70 years old and broke my femur, and I just started taking estradiol and progesterone. Good for you. Do I take it every day? Oh, I would. One states 1 click and the other states 2 clicks, and the quantity is 30. Are both 30-day supply? I want to know when I need to reorder. I appreciate your expertise. God bless you. Thank you, Dolores. It sounds like you're taking 1 click a day of the pink estradiol Topiclick, and the white Topiclick is the progesterone. And usually we put people on it 2 clicks for like 1/2 of a month, like the 1st through the 15th, always the 1st through the 15th of each month. That way, you'll use them up at the same time every month. You're using 2 clicks over 15 days, 1 click over 30. They're both done at the end of the month. And well, let's see. No, the estradiol will last you 120 days, and the progesterone should last you 120 days. So that should be a 4-month lasting tubes. And I'm glad that you're using it. You have to learn how to do some stomping, weight bearing, and you need to be on the vitamin D with K2, a low carb diet, not eat late at night, drink enough water, those kind of things. So Dolores, yes, I'm proud of you. Harlow says, should a man in his 60s with a 312 testosterone level be on testosterone shots, or would natural testosterone help better? Well, testosterone is natural, whether it's a shot or any other lozenge or a topical cream, however you're doing it. Which do you recommend and how much? Well, Harlow, it depends on what time of the year that man took the took the lab test for the testosterone. Because in men, there's a biannual phase. So the testosterone starts climbing around late spring, early summer, so that all male animal kingdom and human men have a increasing testosterone, which will be increased libido for the sake of getting all the impregnable female animals and wives pregnant, so that all the little baby animals, for the most part, are started in the fall and birthed in the spring. Then God has the testosterone drop right after around the late fall, early winter, and spring, so that the boy animals are not aggressive and they won't eat their newborn pups. So there's a biannual swing, and it drops in the later fall, early winter, and it slowly starts to climb from the late spring all the way to late summer, early fall. And so it could be a normal level of 312. It could be a normal level. Now, when I was a younger doctor in the 1970s, men's testosterone were always much higher. It was like 1,600, 1,400, 1,200. I think the low back then would have been around 800, 700. Nowadays, the blood ranges from like 150 to, maybe 700. It's really sick how our lifestyle, stress, junk food. 80% of the food in grocery stores never existed before. They're all packaged junk food. All this alcohol, all this electromagnetic energy, all this stress, all this staying up too late. But anyway, so what do I think is probably the best way to do it? I like topical testosterone because we can manage it easily. Once you inject a volume in, that is going to have this kind of seesaw throughout the once a week, up and down, up and down. And you have to be consistent for the doctor to understand at what point since the last shot where your level is. And topically, it's much, much more consistent and under our control, your control, the patient's control. There are lozenges. You can have it where you can suck on it and have a lozenge, and it is absorbed through the skin under your tongue. So there's all kinds of way to do it. The level of 312 depends on the time of year it was done. If it's a winter reading, early spring, it should be low, okay? And which, she goes on to say, what's better to use for frying, beef tallow or lard? I think they're equivalent. I think they're both fine, and I have both, and I use both. And I save my bacon grease, and I do use butter sometimes, and I have coconut oil. But I think beef tallow is just wonderful. So I guess that's the end, and I have somewhere to get to. So I am going to end tonight. I got everyone's question, and we'll go from there. And I will see everyone next week, Tuesday night, 6 o'clock in the evening. The Lord bless you and keep us all, and may we seek him with all our hearts, all right? In Jesus' name I pray, amen. Good night, everyone. God bless.